At the end of the day, they get what they want and I get the much needed money.
For Eric and Susan, however, the issue isn't so black and white. They're happy that their Indian surrogate gave them a shot at completing their family.
You know, she didn't seem at all upset. She seemed like she did something really nice, and as far as I'm concerned, she did.
Ending their 10-year journey to have a baby in a place they never expected. Priya Sridhar, RT, New Delhi, India.
The man whose work led to the first test tube baby in the world, Dr. Robert G. Edwards, has won the Nobel Prize for Medicine.
The 85-year-old British researcher is considered the pioneer of in vitro fertilization.
British physiologist Dr. Robert Edwards, whose work led to the first test tube baby, has won the 2010 Nobel Prize for Medicine and Physiology, along with a prize of $1.5 million. Starting in the 1950s, Edwards and the late Patrick Steptoe developed the IVF technology that has helped millions of infertile couples conceive what are called test tube babies. In this, egg cells are fertilized outside the body and then implanted in the womb.
We can, for example, mention the situation when a young woman gets cancer and she has to receive treatment with irradiation or cytostatic drugs, which will damage her eggs. Now what you can do now is to take out her eggs and freeze them, and then later, after the cancer treatment, come back and fertilize those eggs with the sperm from the partner and then give them back to the woman.
The first test tube baby was born back in 1978, and Edwards and Steptoe founded the first IVF clinic at Cambridge 2 years.
Hello and welcome to We the People. It's clear that the face of parenthood in India is changing and changing.
Like this, I am Dr. Gupta, practicing infertility in Delhi for 12 years. We have delivered almost like maybe 100 surrogates in Delhi. Maybe it was not accepted lawfully or unlawfully, but we felt it is right of the person to carry and to procreate.
Why not adopt?
No, they normally, what patients we get for IVF management, they 25% of them, they have adopted babies, but still they want to have the baby of their own.
So we let her catch her flight.
First of all, I want to say adoption and IVF are two different things. You cannot mix two things together. You cannot equate or you cannot do it. Adoption is the one which are abandoned children lying in orphanage that you cannot force on the 25% of the couple who is unable to produce.
Okay, but why is it different from the organ trade if you allow money to trade hands? How do we know that women will not be exploited? Poor women will not be exploited.
Of course they will be exploited. Where I'm saying no,
then
they would be exploited.
And why is that okay?
Therefore we have to make a proper laws and regulations that prevent such things which has happened in kidney donation before.
Okay, so you're saying regulate it, don't stop it.
Yes.
But one final question. When should the child be told the identity? Because according to the ICMR guidelines, right now the child is deliberately not told the identity of both mothers.
It is identity. You can keep it as a secret because we really do not know what sort of a mental they will face in the future. Certainly identity has to be disclosed in future in case there are some complications, like they require some tissue, they require some blood transfusion, they require some stem cell transfusion.
If there is a complication in the childbirth, ma'am,
yes,
who is responsible for the well-being of this poor woman?
Genetic parents.
Genetic parents.